Have you got pain right around that inner part of the groin? A common cause is due to an issue with the adductor muscles of the hip. So, what are the best exercises you can do for this? Well, that's exactly what we are covering in this video. Hi, my name is Rob from AMR Physio, and the hip adductor is a pretty neglected muscle. You'll get it through general leg work like squats, but many are not giving direct attention to it. So doing some of these exercises in this video, even without an injury, would still be good. Now, a strain to this area can come in different severities. A grade 1 maybe taking a few weeks to settle, but a grade 3 could be months. It's most common due to sports and normally involves the adductor muscle group, and of that group, the adductor longus muscle. The exercise you're going to start with and ones you do will depend on severity, and you want to be making sure the exercise you're doing doesn't aggravate anything during or afterwards. If it does, the exercise is likely too hard for the stage you're at, and you'll need to make it easier. We have 5 exercises that are in order of difficulty. You should aim to gradually build up through these levels to get back to full function. Exercise number 1 is an adductor squeeze. For this, you'll be keeping the hip joint still but activating the adductor by squeezing something in between your legs. This can be a cushion, a ball, even a foam roller. Generally, the further apart your legs, the more uncomfortable this may feel, depending on the initial severity. The good thing with this exercise is you can adjust the difficulty just by how hard you press. Not ideal as you can't have a true measure, but it's a starting exercise and you shouldn't feel pain during or following this. If you are, reduce the amount that you're squeezing. As this starts to feel better, you can move on to exercise number 2, which is a side lying adduction. So laying on your side, move the top leg out of the way and you'll be working the bottom leg. Lift the leg up and hold and then slowly lower. Do this both sides but equal the amount of reps to what the affected side can tolerate and work on gradually building this up. Number 3 is a weighted adductor exercise. So this is to start getting more resistance through the muscles and is useful as you can scale it by easily changing the amount of weight that you're using. The easiest way to do this is if you have an adductor machine. Keep the movement slow and purposeful. Sometimes doing it with speed and too quickly can be aggravating. If you don't have an adductor machine, you can use a cable machine to do it. Having a slightly raised surface can make this better. Just make sure it's stable. Number 4 is Cossack squats. So you start in a split stance. You will then lunge down on one leg, keeping the other in place. Only go as far as is comfortable. You'll then switch to the other leg. As you're coming back up, you'll put some weight through the other heel, which will load the adductor, and it's also great because it will help with progressing work on mobility. Number 5 is the Copenhagen plank. This is the ultimate exercise to work on for the adductors with the best evidence around it to help with reducing groin injuries. Normally you do this with someone holding your leg. However, if you're by yourself, you can do this at different levels. Find something you can put your leg on and get your other leg underneath. Then you can start with your knee on it and the other foot on the floor. Then with your foot on it, still with the other leg on the floor. But the next step is to have the knee with the other leg lifted. And the final stage is the foot with the other leg lifted. You can just build this up though with different parts of the leg touching. It's easiest closer and hardest with the foot on it. During rehab, it will also be important to modify activities and rest from the aggravating ones, which for many will be the sport that you play. You gradually want to be returning to this as things start to improve, incorporating more rehab movements specific to the sport you play. So now you know all the exercise to work on, but you also need to know how to progress reps and exercises. Otherwise, you won't be able to implement the rehab effectively. That's why you need to watch this video next if you want to learn about how to safely and effectively progress the reps and exercises and other pointers of how to approach recovery in the best way.